Welcome to the Guide for Elderly Care, brought to you by the UH School of Nursing and Pearl City Public Health Nurses. Do you have someone in your life that is getting older? Has a loved one had a recent injury or medical issue? Do you want to be prepared for your loved one's future? Hopefully we will be able to supply you with some information that can help you along your journey. Feel free to pause the video at any point or ask questions at the end. Stay strong for your loved ones. One thing that is really important to consider is that many of these conversations are very hard to have. There may be information that is very hard to even consider. Taking that extra step and having the conversation now can make things much easier in the future. In the unlikely situation that something happens and your loved one is not able to express their concerns, you will know what they want and be able to preserve their dignity and honor their wishes. Things to get. Here are some important documents that will help support you in the process of caring for an aging loved one. These documents can be obtained all at once or over the course of care. These are not requirements, only items that may help you with the transition to end-of-life care. Documentation. The HIPAA authorization allows you to gain access to your loved one's medical records. The healthcare POA, or power of attorney, is a legal document which allows you to make important decisions for your loved one, including what medical care they receive depending on finances, where they will live, what they will eat, and who bathes them. The Advanced Healthcare Directive is a document that combines the POA and the living will. It is mostly concerned with whether the elder one will be receiving aggressive medical care or hospice-type care. The PULST is its medical counterpart that must be signed by a PCP or an APRN. It lets the medical staff know whether they'll be implementing such measures as CPR, intubation, nutritional implementation, or measures such as comfort care. Other financial documents, like the financial power of attorney, gives a loved one the legal authority to help them pay for health care and housing needs, file taxes, pay bills, and make investment decisions. The trust is an essential planning document that specifies certain assets and how they should be distributed. There are many different kinds of wills, each with different stipulations regarding how assets and property are to be doled out after a person dies. Care worksheets with contact numbers have all caretakers, doctors, insurance, and critical information in an easy-to-access location. Case managers. Case managers can be found in both medical and social services. Medical case managers usually work in various health case housing options. When your elder loved one is getting to a point where they cannot care for themselves and others are not available to help them, you must consider outside help or even nursing care homes. These are some options that are available to you and some common terminology used. Senior housing option 1. Aging in place. Staying at home as you age has the advantage of keeping you in a familiar place where you know your neighbors in the community. There is a wide range of home care services that can help you maintain your independence within the comfort of your own home, from in-home care to daycare. You may also be able to make home repairs or modifications to make your life easier and safer, such as installing a wheelchair ramp, bathtub railings, or emergency response system. Staying at home may be a good option if you have a close network of nearby family, friends, and neighbors. Transportation is easily accessible, including alternative transportation to driving. Your neighborhood is safe. Your home can be modified to reflect your changing needs. Your physical and medical needs do not require a high level of care. You have a generous personality and are willing to be able to reach out for social support. Senior housing option 2, independent living. Any housing arrangement designed exclusively for seniors. Other terms include retirement communities, retirement homes, senior housing, and senior apartments. These may be apartment complexes, condominiums, or even freestanding homes. In general, the housing is friendlier to older adults. It's more compact, easier to navigate, and includes help with outside maintenance. Sometimes recreational centers or clubhouses are also available on site. Senior housing option 3, assisted living. Also known as residential care, board and care, congregate care, adult care home, adult group home, alternative care facility, or sheltering housing. In general, assisted living is a housing option for those who need help with some activities of daily living, including minor help with medications. Cost tends to vary according to the level of daily help required, although staff is available 24 hours a day. Senior housing option number 4, nursing homes. A nursing home is normally the highest level of care for older adults outside the hospital. While they do not provide assistance in activities of daily living, they differ from other senior housing in that they also provide a high level of medical care. A licensed physician supervises each resident's care, and a nurse or other medical professionals is almost always on the premises. Skilled nursing care and medical professionals, such as occupational or physical therapists, are also available. Things to look out for. It may be difficult to know when to seek help. A lot of the time, the progression of illness is slow and hard to see in someone you love. Also, many times people will try to hide their issues. There are some things that you can look out for that might need attention. Signs and symptoms. Things to look out for during elder care. Are your elder loved ones able to take care of themselves? Pay attention to your elder loved one's appearance. Failure to keep up with daily routines, such as bathing and toothbrushing, could indicate dementia, depression, or physical impairments. Also pay attention to their home. Are the lights working? Is the heat on? Is the yard overgrown? Any changes in the way that they do things around the house could provide clues to their health. Are they experiencing memory loss? Everyone forgets things from time to time. Modest memory problems are fairly common, part of aging, and sometimes medication side effects or underlying conditions contribute to memory loss. There is a difference, though, between normal changes in memory and the type of memory loss associated with Alzheimer's disease and other types of dementia. Are your parents' memory changes limited to misplaced glasses or an occasionally forgotten appointment? Or are these changes more concerning, such as forgetting common words, getting lost in familiar neighborhoods, or being able to follow directions? Are they safe in their home? Take a look around their home, keeping an eye out for any red flags. Do they have difficulty navigating narrow stairways? Have they fallen recently? Are they able to read directions on medication containers? Are they safe on the road? Driving can be challenging for older adults. If they become confused while driving, or you're concerned about their ability to drive safely, it might be time to have a conversation about driving. Have they lost weight? Losing weight without trying could be a sign that something's wrong. Weight loss could be related to many factors, including difficulty cooking. They could be having difficulty finding the energy to cook, grasping the tools necessary to cook, or reading labels or directions on food products. It can also be related to many diseases that commonly plague older adults. Are they in good spirits? Know your loved one's mood and ask them how they are feeling. Drastically different moods or outlooks could be signs of depression or other health concerns. Are they still social? Also talk to your elder loved ones about their activities. Are they connecting with friends? Have they maintained interests and hobbies in other daily activities? Are they able to get around? Pay attention to how they are walking. Are they reluctant or unable to walk unusual distances? Have they fallen recently? Is the knee or hip arthritis making it difficult for them to get around the house? Would they benefit from a cane or walker? Issues such as muscle weakness and joint pain can make it difficult to move around as well. If they are unsteady on their feet, they may be at risk for falling, a major cause of disability among older adults. Sundowning. Very agitated behavior that becomes more pronounced later in the day is a very common characteristic of those with Alzheimer's. Slips and falls. Falls are one of the greatest risks for elders. They can have massive repercussions that will quickly lead to the deterioration of health. Take note after the first fall, because mistakes can happen, but if there's an underlying cause that will lead to more falls, then you can miss out on an issue that will quickly reduce the quality of life of your loved one. Difficulty breathing or shortness of breath. Pain or pressure in the abdomen or chest, confusion, abrupt dizziness, and or violent continual vomiting. Dehydration. Symptoms of dehydration in the elderly include poor skin elasticity. The skin, when pinched, does not return to its normal shape, as well as headache, dizziness, unusual dark urine or inability to urinate, weakness, dry mouth and nose, and nausea and vomiting. Chest discomfort. Both men and women, the classic signs and symptoms of a heart attack, usually involve discomfort in the center of the chest lasting more than a few minutes, or that go away and come back. The pain can be stabbing or crushing or feel like an uncomfortable pressure, squeezing, fullness, or burning pain. Discomfort in other areas of the upper body. Other heart attack signs and symptoms men and women experience include squeezing pain in the chest or upper arm that radiates to one or both arms, the back, shoulders, neck, jaw, or stomach. Understanding health insurance. Health insurance is a topic of its own. We will cover some basics, but it is suggested that you spend some time seeking out more information and educate yourself. Medicare. Federal insurance for persons 65 and older and certain people with disabilities. You are required to have worked for over 10 years. Does not cover deductibles, copays, premiums, long-term care, and skilled nursing facilities. Care over 100 days. Enroll before age 65 for increased convenience. You can choose a provider and decide to enroll or not enroll in a Part B at a lower copay. Medicare Counseling, formerly SAGE Plus, provides statewide health insurance information, counseling, and referrals to people 60 years or older. Their families and caregivers, trained volunteers, counselors, provide consultations and presentations at no charge to the public. Insurance. Medigap. Medicare supplement insurance that may fill the gaps for coverage that may not be provided in basic Medicare. Medicaid. State health insurance program for those with certain disabilities, medical conditions, persons 65 years or older, or with very low incomes and limited assets. Most services are provided at no charge. Understanding costs. Non-medical home care services. No referrals needed, but these services are not covered by Medicare. Companionship, housekeeping, medical preparation, transportation, shopping, financial issues, and ADLs, or adult daily living activities. Medical home care services. Referrals needed from your doctor or APRN, case manager, or social worker. Forms vary on the type of home care that is needed, and most services are covered by Medicare. Nursing care, physical therapy, occupational therapy, speech therapy, social workers, home health aides. Understanding medications. Medications are one of the most confusing and constantly changing aspects of elderly care. There are many different effects of medication, and taking them as prescribed is extremely important. If at any point in time you are confused about something with medications, the best course of action is to ask your local pharmacist or doctor about it. Tips for managing your medication. Each person should have one pharmacist to manage all their medications. Call your pharmacist if you have medication questions. They have updated information on medication interactions and side effects. If you see signs of a medication interaction, call 911. When seeing your physician, bring updated list of medications and all your medication bottles. 50% of medications for chronic diseases are not taken as prescribed. Medication reminder systems. Set phone alarms or use a calendar. This method can be helpful for people who take medication on specific days. Pill boxes. Various types of pill boxes exist. Some are plastic and include labels for the days of the week. Others have digital timers that are specific times to dispense the appropriate medication. Ask your doctor. Before taking a drug, ask your doctor or pharmacist the following questions. Can I take it with other drugs? Should I avoid certain foods, beverages, or other products? What are possible drug interaction signs I should know about? How will the drug work in my body? Is there more information available about the drug or my condition on the internet or in health or medical literature? Information to discuss with a doctor. Any new or unusual symptoms? What prescription medications they are on, including changes in dosage or new prescriptions since your last visit. Changes in elderly daily routine, including deviations from the norm, may indicate underlying health issues. Taking a look at the label of prescription medication, there are a few things to note. 1. The pharmacy at which you are getting it. 2. The number, name, and address. 3. The directions on how to take the medication. Remember to read these carefully. 4 is the number of refills, if any, that are available. The phone number of the pharmacy and the date on which it was filled. And finally, the best if used before date. Remember, do not take drugs after their expiration date. Drugs do expire. This is an example of an over-the-counter medication. In general, it is good to read the whole thing, but one of the most important aspects to read is the directions. One thing to note is that some medications, although similar, have different dosage or number of pills that you take for the proper dose. This is an example of a good medication list. You can find these online or copy this one. It should include the name, dose, time at which you take it, the prescribing physician, what it is for, and possible major side effects to look out for. Take this list with you to all physician and hospital visits. It will make your doctor very happy. Thank you very much. And if you live in the Pearl City or Wahiawa area and have any questions, feel free to call the public health nurses. This video was produced by Christian Berg. The content was by Christian Berg, Amy Chong, Romy Sealy, and Eve Teeter-Ballen, members of the UH Manoa Meppen cohort 2015. Special thanks to the public health nurses of Pearl City and Wahiawa.